Breast cancer is the most common form of cancer affecting women. The incidence is growing, with about 2 million new cases worldwide every year. In the United States alone, the American Cancer Society, ACS, predicts that 13% of women will develop breast cancer in their lifetime. The National Cancer Institute, NCI, estimates that about 280,000 women trusted source will be diagnosed with breast cancer in 2021, and about 43,000 will die of the disease. The ACS also predicts that about 2,750 men will be diagnosed with breast cancer in 2021, and about 550 will die from the disease. 5-year survival rate. The median age that women are diagnosed with breast cancer is 62 years old. The NCI reports that 90% trusted source of women with breast cancer survive 5 years after diagnosis. This survival rate includes all women with breast cancer, regardless of the stage. The 5-year survival rate for women diagnosed with localized breast cancer is about 99%. For women who are diagnosed with regional breast cancer, that figure drops to about 86%. Women who are diagnosed with distant breast cancer have about a 28% likelihood of surviving for 5 years. A 2017 NCI study showed that from 1992 to 1994 and 2005 to 2012, the 5-year survival rate for women ages 15 to 49 years old diagnosed with distant breast cancer doubled, from 18% to 36%. 10-year survival rate. The ACS reports that the 10-year average survival rate for women diagnosed with breast cancer is 84%. Another study of over 4,200 young women with breast cancer found that the 10-year survival rate for the women with tumors smaller than 2 centimeters was 89%. For those with tumors equal to 2 centimeters, it was 86%, and for those with larger tumors, the survival rate was 81%. 30-year survival rate. The average rate for women surviving at least 15 years after being diagnosed with breast cancer is 80%. Statistics are not available for survival rates by cancer stage. Researchers have found that women diagnosed with stage 1 breast cancer have higher 30-year survival rates than those diagnosed with stage 2, 3, or 4 breast cancer. Each advanced stage has lower survival rates than earlier stages. This was true regardless of whether the women had surgery with radiation therapy, or a combination of treatments including surgery, radiation therapy, chemotherapy, and endocrine therapy. Risk factors that increase your chances of getting breast cancer. There are several risk factors that increase your chances of getting breast cancer. However, having any of these doesn't mean you will definitely develop the disease. Some risk factors can't be avoided, such as family history. You can change other risk factors, such as quitting smoking, if you smoke. Risk factors for breast cancer include 1. Age. Your risk for developing breast cancer increases as you age. Most invasive breast cancers are found in women over age 55 years. 2. Drinking alcohol. Alcohol use disorder raises your risk. Having dense breast tissue. Dense breast tissue makes mammograms hard to read. It also increases your risk for breast cancer. 3. Gender. White women are 100 times more likely to develop breast cancer than white men, and black women are 70 times more likely to develop breast cancer than black men. 4. Genes. Women who have the BRCA1 and BRCA2 gene mutations are more likely to develop breast cancer than women who don't. Other gene mutations may also affect your risk. 5. Early menstruation. If you had your first period before age 12 years, you have an increased risk for breast cancer. 6. Giving birth at an older age. Women have their first child after age 35 years have an increased risk for breast cancer. 7. Hormone therapy. Women who took or are taking postmenopausal estrogen and progesterone medications to help reduce their signs of menopause symptoms have a higher risk for breast cancer. 8. Inherited risk. If a close female relative has had breast cancer, you have an increased risk for developing it. This includes your mother, grandmother, sister, or daughter. If you don't have a family history of breast cancer, you can still develop breast cancer. In fact, most women who develop it have no family history of the disease. 10. Late menopause start. Women who start menopause after age 55 years are more likely to develop breast cancer. 11. Never having been pregnant. Women who have never become pregnant or carried a pregnancy to full term are more likely to develop breast cancer. 12. Previous breast cancer. If you have had breast cancer in one breast, you have an increased risk for developing breast cancer in your other breast or in a different area of the previously affected breast. Factors impacting breast cancer treatment. While breast cancer stage has a lot to do with treatment options, other factors can impact your treatment options as well. 1. Age. The prognosis for breast cancer is usually worse in women younger than 40 because breast cancer tends to be more aggressive in younger women. Balancing body image with perceived risk reduction may play a role in the decision between lumpectomy and mastectomy. In addition to surgery, chemotherapy, and radiation, several years of hormonal therapy for hormone-positive breast cancers is often recommended for young women. This can help prevent a recurrence or spread of breast cancer. For premenopausal women, ovarian suppression may be recommended in addition to hormone therapy. 2. Pregnancy. Being pregnant also impacts breast cancer treatment. Breast cancer surgery is usually safe for pregnant women, but doctors may discourage chemotherapy until the second or third trimester. Hormone therapy and radiation therapy can harm an unborn baby and aren't recommended during pregnancy. 3. Tumor growth. Treatment also depends on how fast the cancer grows and spreads. If you have an aggressive form of breast cancer, your doctor may recommend a more aggressive approach, such as surgery and a combination of other therapies. 4. Genetic mutation status and family history. Treatment for breast cancer may depend partly on having a close relative with a history of breast cancer or testing positive for a gene that increases the risk of developing breast cancer. Women with these factors may choose a preventive surgical option, such as a bilateral mastectomy. Signs of recurrence. Despite initial treatment and success, breast cancer can sometimes come back. This is called recurrence. Recurrence happens when a small number of cells escape the initial treatment. Symptoms of a recurrence in the same place as the first breast cancer are very similar to symptoms of the first breast cancer. They include a new breast lump, changes to the nipple, redness or swelling of the breast, a new thickening near the mastectomy scar. If breast cancer comes back regionally, it means that the cancer has returned to the lymph nodes or near to the original cancer but not exactly the same place. The symptoms may be slightly different. Symptoms of a regional recurrence may include lumps in your lymph nodes or near the collarbone, chest pain, pain or loss of sensation in your arm or shoulder, swelling in your arm on the same side as the original breast cancer. If you've had a mastectomy or other surgery related to breast cancer, you might get lumps or bumps caused by scar tissue in the reconstructed breast. This isn't cancer, but you should let your doctor know about them so they can be monitored. Breast cancer prevention. While there are risk factors you can't control, following a healthy lifestyle, getting regular screenings, and taking any preventive measures your doctor recommends can help reduce your risk for developing breast cancer. 1. Lifestyle factors. Lifestyle factors can affect your risk for breast cancer. For instance, women who have obesity have a higher risk for developing breast cancer. Maintaining a nutrient-dense diet and getting regular exercise as often as possible could help you lose weight and lower your risk. Alcohol misuse also increases your risk. This can be having more than 2 drinks per day or binge drinking. However, one report that analyzed worldwide research showed that even 1 drink per day increases your risk for breast cancer. If you drink alcohol, talk with your doctor about what amount they recommend for you. 2. Breast cancer screening. Having regular mammograms may not prevent breast cancer, but it can help reduce the chances that it will go undetected. The American College of Physicians, ACP, provides the following general recommendations for women at average risk for breast cancer. Women ages 40 to 49. An annual mammogram isn't recommended, but women should discuss their preferences with their doctors. Women ages 50 to 74. A mammogram every other year is recommended. Women 75 and older. Mammograms are no longer recommended. The ACP also recommends against mammograms for women with a life expectancy of 10 years or less. Recommendations from the ACS differ. According to the ACS, women should have the option of receiving annual screenings at 40 years old, begin annual screenings at 45 years old, and move to biennial screening at 55 years old. Specific recommendations for mammograms are different for each woman, so talk with your doctor to see if you should get regular mammograms. 3. Preemptive treatment. Some women are at increased risk for breast cancer due to hereditary factors. For instance, if your mother or father has a BRCA1 or BRCA2 gene mutation, you're at higher risk for having it as well. This significantly raises your risk for breast cancer. If you're at risk for this mutation, talk with your doctor about your diagnostic and prophylactic treatment options. You may want to be tested to find out whether you have the mutation. And if you learn that you do have it, talk with your doctor about any preemptive steps you can take to reduce your risk for developing breast cancer. These steps could include a prophylactic mastectomy, surgical removal of a breast. In addition to mammograms, breast exams are another way to watch for signs of breast cancer. 4. Self-exams. Many women do a breast self-examination. It's best to do this exam once a month, at the same time each month. The exam can help you become familiar with how your breasts normally look and feel so that you're aware of any changes that occur. Keep in mind, though, that the ACS considers these exams to be optional, because current research hasn't shown a clear benefit of physical exams, whether performed at home or by a doctor. 5. Breast exam by your doctor. If you're having symptoms that concern you, it's a good idea to have your doctor do a breast exam. During the exam, your doctor will check both of your breasts for abnormal spots or signs of breast cancer. Your doctor may also check other parts of your body to see if the symptoms you're having could be related to another condition. Summary. Breast cancer is the most common cancer in women, according to the World Health Organization trusted source. Whether you're concerned about breast pain or tenderness, it's important to stay informed on risk factors and warning signs of breast cancer. As with any cancer, early detection and treatment are major factors in determining the outcome. Breast cancer is easily treated and usually curable when detected in the earliest of stages. This is why it's important to conduct monthly breast self-exams and to schedule regular mammograms. Talk to your doctor about which screening schedule is right for you. In addition to the stage at diagnosis, your doctors will consider the type of breast cancer you have and other health factors. Your treatment plan is adjusted according to how well you respond to it. You can also look into complementary therapies at any stage of breast cancer. These are therapies used in conjunction with standard medical treatments. Many women benefit from therapies like massage, acupuncture, and yoga. The best way to fight breast cancer is early detection. Talk to your doctor about when you should start scheduling regular mammograms. If you're worried that your breast pain or tenderness could be something serious, make an appointment with your doctor today. If you find a lump in your breast, even if your most recent mammogram was normal, see your doctor.